Life doesn't frighten me at all. Not at all. Not at all. Life doesn't frighten me at all.
Hey guys, welcome back to my channel. If you're new here, my name is Miko. If you've been here before, welcome back. I hope that you guys have liked, comment, and subscribed. Be sure to hit that bell to be notified when I drop. In today's video, I am discussing with you guys the time when I got a hematoma after my breast augmentation. Now, I'm not sure if many of you know what a hematoma is, but we are going to discuss the do's, don'ts, and prevention in this video. So let's jump into the video. So, I got a breast augmentation March of 2021. When I did my breast, I think I stayed in Miami for about 2 weeks. Yeah, it was like a good 2 weeks or 2 weeks and a half that I stayed there. I think my surgery date was March 18th, and I think I left towards the ending of March, maybe like March 28th or something like that. I think I left. But prior to that, I had already been in Miami way before. Like, I think I had came to Miami March 13th or something like that. Like, I had already been there for like a while. So another girl that was with me was also getting surgery, so we left a little earlier because her surgery date was a lot earlier than mine. So those of you who are wondering, I'm not sure if you saw my breast augmentation vlog. I did my breast in Miami, Florida with CG Cosmetics. My doctor was Dr. Furman. Okay, let's get into how I found out that I had a hematoma. So I did the surgery and I flew back to New York, and it was March 28th. So I had been back in New York for all of, like, I want to say 2 to 3 weeks. Yeah. And in April, everything was fine. Everything was flowing. I was in love with my breast. I was loving everything about what was happening. The process, I had a very smooth process with my surgery. So one day I was playing with my son's father, and I don't think that we were playing rough or anything like that, but we were like play fighting or whatever. So when we were play fighting, I noticed that he had blood on his shirt. So I was like, wow, I was like, babe, what's going on? Are you bleeding? Because I thought maybe like I scratched him or something like that. So he was like, I didn't know I was bleeding. So he had on a white t-shirt. So we knew it was blood. It was no way that you could mistake that for anything else. It definitely looked like blood. So he took the shirt off and he was like, I don't know. So we was looking at his body to see where he was like cut at, and he didn't have any cuts. So we were just like, wow, that's so strange. Keep in mind that like, the blood that was on his shirt, I don't know how I even paid attention to that, but the blood was very dark, and I had never seen blood like that. Like, it just looked very old. It looked like old blood because it was really, really, really dark. So yeah, so I went into the bathroom, and in my bathroom I have like a long mirror that's attached to the wall. Like, I went to the mirror and I started to take a look at myself because I knew I had just did the surgery a couple weeks back. So I was like, hey, let me just take a look. So as I'm looking, I noticed that the bra that I was wearing, which was my surgical bra, had like blood on it at the bottom. So I was like, what the hell? What is that? So I opened my shirt and I checked my incision, and by golly, when I opened up my surgical bra, there was definitely an opening. Like, my incision was open and it was dripping blood. So I was like, what in the world is going on? Like, this is weird. Like, why would my incision just pop open and start bleeding again? I called CG and I emailed my doctor. My doctor at CG was Dr. Fryman, the best doctor, may I add. He's amazing. Like, he did a wonderful job on my breast. I get so many compliments on my breast. I just want to make that clear that, you know, Dr. Fryman was my doctor. When I told them what was going on, they informed me. They was like, listen, we don't know what's going on, and you're gonna need to come back to us so we could see what's happening. So I was like, okay. So I booked a flight and I went back to Miami. When I got to Miami and I went to the doctor, they informed me that I had something called a hematoma. I was not aware of what a hematoma was. What's interesting is I did a lot of research on my breast augmentation, and what's strange is I had never even seen anyone talking about this, even on YouTube or anything like that. Like, I had never seen anything come up about hematoma, so I was lost. I didn't know what this was. So the nurses came in and they broke down to me. Sometimes women do get hematomas from breast augmentation. They don't really know per se what's the cause, but some women do get a hematoma for whatever reason. So while I was there, they had told me it was either go back under the knife or maybe they could see what they could do manually. So now I started to like freak out a little bit because I'm like, manually, like what are you gonna do manually that's gonna help me? One of the nurses came in, he looked at my breast and he started to just poke and squeeze at certain areas. He asked me if I was in pain, was it hurting when he would squeeze it? And I was like, no, because I really wasn't in any pain. It wasn't hurting me, I was just a little scared because I'm like, why did my incision pop open? That was what was freaking me out. So I was like, I wanted to get back to them as soon as possible because I didn't know what was gonna happen. The incision wasn't opened all the way, it was just partially opened. It was like a little spot that was open and it was like constantly dripping blood. So I didn't know if it would reopen bigger or what. So this is why I wanted to go back to Miami. So anyway, the nurse started to squeeze my breast. I'm not gonna lie, it was a little aggressive. It was aggressive. He started to squeeze it and he kept asking me every step of the way, does this hurt you? Am I hurting you? And I was like, no. And he was like, okay, so this is what I'm gonna do. He was like, since you don't have any pain, any signs of pain, it's not hurting you or anything like that, I'm gonna try to get this blood out of you. I'm gonna squeeze it out with my hands. And I was just like, okay, because he was like, if we don't do it this way, you're definitely gonna have to go back under the knife. So if I can get it all out this way, the incision should close up and it should just heal on its own and you should be fine. He was like, the reason why my incision opened was because my body, the body is something. The body is so smart. Let me tell y'all what my body did. Because my breast was holding old blood, like the bottom where my incision was, my incision literally popped open so that it can get rid of the blood. My body was basically telling itself, get rid of this blood, it's old and you don't need it. So that's why my incision popped open, so that I could release it. So I was like, wow, like the body is just so interesting. So I ended up squeezing out all the blood. And I was fine. My breast wasn't hurting me. He didn't hurt me. Like, it was fine. He was like, girl, he was like, you are a trooper. Like, you so strong. Because he was like, I feel like if this was anybody else, they would be like screaming. After he released all that old blood out of my breast, I stayed in Miami for about a week and a half. I stayed there just for them to monitor my breast, just to see if it heals up nicely, if my incision heals on its own, and it did, and everything was fine. I really wanted to do this video because I just wanted to do it for anyone who needed to know if they got a hematoma after they got a breast augmentation. I had a friend of mine who recently just did her breast and she got a hematoma. And it was interesting because when she noticed that something was wrong with her breast, she was like, oh my God, I gotta call Miko. Like, I gotta ask her what this is. And immediately, like, she told me her symptoms. When she showed me her breast, I was like, babe, you have a hematoma. Hers was a little more severe than mine because hers was like really big. I really didn't have like a big bump or anything like that, or like bruising. My incision just popped open and the blood was trying to release itself. So mine was like very mild. So now I will say this, I'm gonna be 100 with y'all because I don't want y'all to do what I did. I believe that when I got my breast done, the day that I got out of surgery, I was fine. When I tell y'all I had no pain, I didn't feel anything. I felt so good. I felt like I could just do whatever. So the actual day of my surgery, I went back to the hotel and I rested and I slept and I took my meds and all the pills that the doctor gave me. The next day when I woke up, because I didn't feel any pain, I decided to go outside and get some fresh air. So I went outside and walked around a little bit, which you are supposed to walk around. That's what I would say. Any surgery that you get, you have to walk around just to keep your blood circulating, because that can also cause a blood clot if you don't do that. So I felt like it was a really good thing to walk around, but I felt like maybe I should have just went to the restaurant and back to the hotel, because I was out and about. I felt fine, so that's how I acted. You understand? But what I realize now is that that was a major surgery and I should have been resting. I shouldn't have been walking around a lot and overexerting myself. You know what I mean? I felt like I walked enough and that was fine, and then I was supposed to just go back to the hotel and just rest. So I think that was part of the problem to why I got that mild hematoma. I didn't really do anything too crazy, but I definitely did enjoy myself that day for a couple of hours out and about in Miami. So I think that maybe that could have been a thing or not. Maybe that was just something that was supposed to happen. Who knows? But I wanted to mention that because that was actually what happened to my friend. She actually got a hematoma that was really bad, because instead of her going back to the hotel and resting the day of, like myself, she felt fine. So she was out and about with her friends in Miami and they was outside. She didn't go rest. Her body just came out of major surgery. So she was supposed to be resting, you know? So again, this is just my theory. This is not something that the doctors told me or anything like that. It's just my theory. Any of y'all women out there that are getting a breast augmentation, when I tell y'all, please rest your body. Even if you feel okay, trust me, you're not okay, because your body is adjusting to a foreign object in your body and you had to undergo the anesthesia and things like that. So you have to make sure that you're okay and you're taking care of yourself. So I want to explain to y'all a little bit about what a hematoma is. So what is a hematoma? A hematoma is generally defined as a collection of blood outside of blood vessels. Most commonly, hematomas are caused by an injury to the wall of the blood vessel, prompting blood to seep out of the blood vessel into the surrounding tissue. So that's what I meant. When my incision pops open, that is what was happening. My body was trying to tell itself to release this old blood. Bleeding, also known as a hematoma after breast surgery, bleeding can occur when a blood vessel starts leaking into the space created for the breast implant. Let's talk about some of the things that might cause you to get a breast hematoma. So what causes a breast hematoma? Breast hematomas may form after trauma to breast tissue because of an injury or procedure. For example, hematomas may develop after a sports injury, a fall, or from the pressure from a seat belt during a car accident. The rates of hematomas following breast procedures are very low. I want y'all to keep that in mind too. I feel like this is part of the reason why I didn't see many videos like this on YouTube, because I feel like they said, the chances of you getting a hematoma are very low. It happens to a small percentage of us, but not a lot of us. So this is why. What does a breast hematoma look like? A greatly enlarged breast beyond the size of the implant and beyond normal swelling is also cause for concern. Other signs include severe darkening around the skin, around the implant. It will look like a massive bruise and it will not fade with time. So I'm gonna pop some pictures on the screen for you guys so you will know what a hematoma looks like, because I'm pretty sure, like myself, I did not know what a hematoma was. It did not pop up when I did my research, so I wasn't aware. Just in case, if you ladies do get a breast augmentation and something like this occurs, you'll know right away, what's going on with your body. What are the risks of flying after breast surgery? You should wait at least 6 weeks after surgery before flying. This is due to an increased risk of blood clotting and infections following surgery. I knew that I didn't want to fly back right away. There was some videos that I was like watching on YouTube, and a lot of the girls either got it in the state that they lived. That's the reason why, because they didn't want to fly, knowing that they just got this major procedure. And then other girls went out of the country, but they stayed there for a while. For me, I was like, okay, I feel like 2 weeks should be fine for me to be able to fly back home. I was getting like BBL or anything like that. I feel like a BBL requires a lot more time, maybe even like a month. But again, people have to get back to their life or get back to work, so they don't have the luxury of staying somewhere for a month unless you took vacation time. I would say if you were to even get a BBL, I would say, yeah, try to take off like more time, or try to use like vacation time for like a month, so that you're able to like heal at least like some. I mean, you're not gonna heal in a month, but you should be able to heal more than usual, so that like when you're flying back, you can be comfortable. Because I remember like flying back with my friend, and she was very uncomfortable, even like sitting in the seat and whatever, like she was uncomfortable. So all my little BBL girlies, when I tell y'all, try to get like a good little month in, so that y'all could stay, and by the time y'all fly back, like I feel probably a little better. You're not gonna feel 100%, but you're gonna feel like a little better. Can flying affect breast implants? You may have heard about breast implants exploding at high altitudes. This is just a myth. It is completely safe to fly not too long after breast enlargement surgery with silicone breast implants. In fact, many of our breast enlargement patients have been air hostesses and pilots and had no problems at all. I tried to look up questions for you guys that I think that you guys would want to know, as far as like, you know, getting a hematoma, because as of this point right now, I don't really know what causes it. It's only like a couple of things that we're gonna mention in this video that could cause it, but those are like quite obvious, like, you know what I mean? But like other than that, like I don't know like what can actually cause like a hematoma. What causes a hematoma after breast augmentation? The cause of an acute hematoma after breast augmentation with implants may be inadequate hematomasis during the surgery, or congenital, acquired, or drug-caused coagulation disorder. Trauma is also one of the factors. You have to do something very detrimental to your breast to get a hematoma after you get your breast done. So yeah, that's what I'm saying. Like, it's really hard for you to get one, but if you do get one, it's like, what is the risk? Will a breast hematoma go away? Most hematomas will heal on their own. Healing may take from 4 to 6 weeks or longer. Very large hematomas might have to be surgically drained. So again, let's go back to when I said that the doctor asked me if I was okay when he was squeezing it, because if not, I would have to go back under the knife again, and they would have had to drain all that blood out and then reposition my breast again. So that would have been like a longer healing process for me had I had to go back under the knife. Here we're gonna talk about some of the ways that you can reduce your chances of developing a hematoma. Okay, so number one, you want to wear your compressive straps for your breast. You want to wear your surgical bra all the time as diagnosed by your doctor. You just want to be on the safe side. You want to do exactly what your doctor tells you to do as far as the healing process goes, because that's what I did. Whatever Dr. Fryman told me to do is what I did. Another thing that I did was I started to take my arnica pills before and after my surgery, especially after. Arnica pills is a very good way for your breast to heal as far as like bruising goes. It's very, very good. I remember being in Miami and I ordered like arnica gel as well, just for like bruising. My breasts were very swollen. They were very bruised. They were like black and blue and burgundy under my breast. So I wanted to remove all that discoloration. So I used arnica gel as well as I took my arnica pill. I would take your medication as directed by your doctor. Try to rest to prevent like nausea and vomiting. Again, I didn't have any of those symptoms because I felt completely fine, but there are other women out here that just might be a little sensitive to surgery and the anesthesia. So yeah, I know that some women tend to feel a little nauseous and stuff like that. So like, yeah, try to rest as much as you can. Another thing is, I know we got some little smoker girlies or whatever. Try to not smoke before and after your surgery. I know it's gonna be hard, but if you want your breasts to look the absolute best, you have to try to like comply with what the doctor's healing process is for you. So yeah, I would just say like, don't smoke at all. Yeah, like if you want your breasts to heal and heal correctly, you should not smoke before or after. Okay, so now let's talk about some do's and don'ts. I would say to use cold therapy, meaning I would do a lot of cold compresses on your breasts or ice wrapped in a towel for at least 20 to 30 minutes. 3 times a day for the first 48 hours of your breast augmentation. Eat healthy. I remember when I was in Miami, I ate completely clean. I drank a lot of green juices, a lot of salads. I ate clean because I wanted my healing process to go smoothly, you know? So I tried to stay away from like fast food and, you know, fried food and oily food. Like I stayed away from all that stuff. Avoid blood thinners. Don't take aspirin or ibuprofen, which can thin your blood and prolong bleeding. Avoid excessive heat. Avoid the sun, hot tubs, and heating pads. Avoid strenuous activity. Rest as much as possible. Avoid heavy lifting or overexerting activities. And last but not least, follow your doctor's orders. Now that we are at the end of the video, thank you so much for watching, and I'll see you in the next video.